6 medications that skyrocket heart attack risk in seniors over 60. Warning: if you're over 60 and take any of these 6 medications, pay close attention right now. In over 28 years, practicing family medicine and working in the cardiac ICU, I've lost count of how many patients came in with a massive heart attack after taking one of these medications the night before. The worst part, it was almost always prescribed by a doctor. I remember one patient, William, 67 years old, a retired teacher from Ohio. He came in on a Tuesday morning. Gray complexion, chest pain, cold sweats, classic heart attack. When we went through his medication list, we found the culprit immediately. He had been taking it for years. His family doctor had prescribed it. He thought it was completely harmless. William survived, but he needed 3 stents. His life changed forever. Today I'm going to show you who these villains are and how to protect your heart before it's too late. And look, the last one on the list is going to shock you. It's a pill that's sitting in the medicine cabinet of almost every adult over 60. Could it be in yours? But first, hit the like button, subscribe to the channel so you don't miss any of our health tips, and turn on the notification bell. And please, spread this knowledge with your friends and family. By sharing, you could literally save the life of someone you love. So share it, and let me know in the comments, have you ever had a heart attack? Did you suspect a medication might have caused it? Which one? And where in the world are you watching from? Write it below. Let's review the 6 hidden villains item by item. Grab a pen and a piece of paper. But first, an important warning. This video does not replace your doctor's advice. Do not stop any treatment on your own. Ready to take notes? Villain number 6, decongestants and cold medications. Villain number 6, you've probably used plenty of times. Decongestants and cold medications, the hidden enemy inside your cold medicine. You know the scenario, right? You have the cold of the century. Your nose is completely stuffed and you can't breathe. You run to the pharmacy and grab Sudafed, Dayquil, or Afrin. In 20 minutes, it feels like a miracle. You can breathe freely again. But here's what no one tells you. Drugs like pseudoephedrine and phenylephrine don't just act on your nose. They act like a clamp that squeezes the blood vessels in your entire body, including the arteries that feed your heart. They release noradrenaline, the stress hormone. Imagine your heart right now. It starts beating faster, trying to push blood through pipes that just became stiff and narrow. If you're over 60 and already have a plaque here or there, this pressure can cause a spasm. The artery closes up and won't open on its own. That's a heart attack you bought yourself. And now, listen carefully, because this is the part the pharmaceutical industry doesn't like to hear. After age 60, your blood vessels are no longer as elastic as they were at 30. The vessel walls have accumulated small deposits over the decades, early-stage atherosclerosis. These deposits are stable as long as nothing disturbs them. But a sudden vasospasm caused by pseudoephedrine is exactly the trigger that can cause a stable plaque to rupture. And a ruptured plaque means immediate thrombus, and a thrombus in the coronary artery means heart attack. One study showed that these medications double the chance of having a heart attack or stroke in the hours following their use. And the worst part, in 2023, the FDA concluded that oral phenylephrine, which is in almost all cold medicines, is completely ineffective. In other words, you are accepting the risk of a heart attack for a benefit that doesn't even exist. I had a patient, Margaret, 63 years old, from Florida. She regularly took cold syrup in winter when she felt unwell. She never thought it could be dangerous. In January, she came to me with a mild heart attack, fortunately in time, but the scar on her heart muscle will accompany her for the rest of her life. Is it worth a deal that costs your life? What should you do? Saline rinses, a humidifier. If things get really bad, use loratadine, Claritine, which is much safer. Don't trade your life for 20 minutes of an unblocked nose. Villain number 5, NSAID anti-inflammatories. And there's another trap. Older patients often take cold medicine along with this one. You know the drill. You wake up with a headache and take ibuprofen. Back pain? Aleve, Voltaren, Motrin? Seems normal, right? After all, they are the best-selling drugs on the planet. American pharmacies sell hundreds of millions of packages of these products every year, but what happens inside your body when you swallow that pill is terrifying. Imagine that your arteries have a private bodyguard called prostacyclin. Its job is to keep the blood pathways open and prevent platelets from sticking together and forming a clot. When you take ibuprofen, diclofenac, or naproxen, you block an enzyme called COX2, and you fire that bodyguard. Without it, your body goes into a triple collapse. First, the vessels tighten and your blood pressure skyrockets. Second, the blood turns into glue. The platelets get sticky and form clots and thrombi. Third, the heart gets overloaded. Your kidneys stop filtering properly, holding onto water and sodium. The heart starts beating with an absurd force just to keep up. In short, it creates the perfect storm for a heart attack. Narrow vessels, clots, exhausted heart. I'm not just saying this to scare you. In 2015, the FDA slammed their fist on the table and reinforced their official warning. The risk of a heart attack can start in the very first weeks of use, even in people who have never had heart problems in their lives. Look at these numbers. Diclofenac, often sold as Voltaren, increases the risk of a cardiac event by 70%. Ibuprofen in high doses more than doubles your chance of having a heart attack. I had a patient, George, 69 years old, retired from Texas. He was taking 600 milligrams of ibuprofen daily for his chronic back pain. His family doctor knew about it. Nobody had warned him. After 8 months, he came to me with an acute coronary syndrome. We saved him. But he asked me, "Doctor, why didn't anyone tell me?" That question still stays with me today. But heads up, for pain relief, there are life-saving exceptions. Low-dose aspirin, baby aspirin at 81 milligrams, does the exact opposite. It protects you. And acetaminophen, Tylenol, which is a pain reliever and not an anti-inflammatory, is also an island of safety for your heart. So if the pain hits, don't play dice with your life. Talk to your doctor about the safer alternatives. I want to pause for a moment. Are you taking either of these medications, cold medicines or ibuprofen? Write it in the comments and your age. I really do read every comment. And your question could become my next video. Villain number 4, omeprazole and proton pump inhibitors. This is the medicine I said would shock you. Omeprazole, pantoprazole, Nexium. These famous stomach protectors are in the bags of 70% of people over 60. Everyone thinks it's like water, completely safe. My doctor prescribed it so I can tolerate my other medications better. Except that science discovered something surprising. PPs don't just act on the stomach. They attack the cells that line your blood vessels. You know nitric oxide, right? That gas that keeps your arteries relaxed and youthful. These drugs crush its production. Without that gas, your vessels become stiff, inflamed, and atherosclerosis speeds up. Let me explain. Nitric oxide is the most important vascular protective molecule your body produces. It relaxes the smooth muscle of the vessel walls. It prevents platelets from adhering to the walls. It reduces inflammation in the endothelium. When proton pump inhibitors suppress the production of this molecule, your blood vessels lose their most important protective shield. Every day, silently and quietly. A Stanford study with almost 3 million patients showed that those who use omeprazole and its cousins have up to a 21% higher risk of heart attack. This even showed up in healthy young adults. Another study showed that chronic use can double the risk of a cardiovascular death. But there is another effect most people don't know about. Proton pump inhibitors block the absorption of magnesium in the intestine, and magnesium is directly responsible for heart rhythm. Magnesium deficiency from years of PPI use can lead to dangerous heart arrhythmias, atrial fibrillation, ventricular fibrillation, sudden cardiac death. The warning here, I'm talking about people who take it for months or years without stopping. If it's a short-term use, for example 7 days for gastritis, don't panic. The danger is the blind, endless use. I had a patient, Dorothy, 71 years old, from Georgia. She had been taking omeprazole every day for 9 years. Nobody had ever questioned whether she still needed it. Her magnesium level was severely deficient. She had developed atrial fibrillation. We carefully discontinued the omeprazole, supplemented magnesium, and the atrial fibrillation resolved in 4 months. 4 months. After 9 years of unnecessary use. Villain number 3, stimulants for ADHD, focus, and weight loss. Ritalin, Vivance, Concerta. What used to be a drug for hyperactive kids became a trend among adults wanting total focus. Big presentation at work? Vivance. Important exam? Ritalin. Want to lose weight? Stimulants from the internet. The problem is, they flood your blood with adrenaline. Your heart beats faster, your vessels constrict, and your blood pressure spikes. Imagine your coronary artery like a garden hose. Normally, blood flows evenly through it. When stimulants release adrenaline, it's as if someone is squeezing the hose while at the same time making the water flow faster. The pressure in the hose explodes. And if that hose already has a weak point, a small plaque, a small thickening, it can rupture. A 2023 Swedish study tracked 278,000 people and revealed that 5 years of use increases the risk of cardiovascular disease by up to 27%. And the risk of hypertension jumps to a terrifying 80%. And for those over 66, the risk of hospitalization for a cardiac event rises 40% in just the first 30 days. Be careful with natural stuff too. Those weight loss pills and pre-workouts from the supplement store often hide dangerous stimulants that the FDA never approved or has already banned. Ephedrine, synephrine, DMAA. These substances are found in products that look like harmless dietary supplements, and they can be deadly for people over 60. I had a patient, Robert, 62 years old, from California. He was taking a weight loss supplement from the internet. 3 weeks later, heart attack. The product contained a stimulant substance that is banned in the United States. Do not buy products from the internet whose ingredients you don't fully know. Villain number 2, corticosteroids. Prednisone, Decadron, and the famous cortisone shots. You know that shoulder pain that disappears in 2 hours with an injection? A miracle, right? Except that steroids attack your heart through 4 factors simultaneously. They retain sodium so your pressure goes up. They spike your glucose. They ruin your cholesterol. And they thicken your blood-promoting clots. Let me explain each of these 4 factors. First, sodium retention. Cortisone makes the kidneys retain sodium. Sodium pulls water with it. Blood volume increases. Blood pressure increases. In a person over 60 who already has high blood pressure, a single cortisone injection can drive blood pressure up by 20 to 30 millimeters of mercury. Second, blood sugar. Cortisone is one of the most powerful blood sugar drivers there is. It promotes glucose production in the liver while simultaneously blocking insulin action in the muscles. In a diabetic or pre-diabetic, and that is the majority of people over 60, a cortisone injection can trigger a hyperglycemic emergency. Third, cholesterol. Cortisone raises LDL cholesterol, the bad cholesterol, and lowers HDL, the protective cholesterol, a combination that directly accelerates atherosclerosis. Fourth, blood clotting. Cortisone increases platelet count and makes them stickier. The risk of thrombosis increases considerably. A study published in PLOS Medicine showed that doses of prednisone above 7.5 milligrams a day used for a prolonged time double your cardiovascular risk. The trap: a patient gets a cortisone injection and thinks it was just a little prick. In reality, that 1 vial is equivalent to taking pills for almost a month, overloading the heart in a silent and dangerous way. I had a patient, Barbara, 65 years old, from Arizona. She received a cortisone injection in her knee every 3 months for osteoarthritis. Her doctor had never explained what it does systemically to her body. After 2 years, she had developed a blood pressure of 175/100 and her HbA1c, the long-term blood sugar, was at 7.2%. She had become diabetic without knowing it. Villain number 1, testosterone injections, pellets, hormone chips, testosterone gels. And now the last one, The most controversial. The elixir of youth that became a craze among men over 50 and women in menopause, and that can be a game of Russian roulette if used the wrong way. Clinics are prescribing this in explosive amounts. Many men are using it without even having a proven deficiency. My testosterone was at 500, so I had to take it, right, doctor? Was it really that low? You shouldn't have taken it. In 2014, a study with 55,000 men showed that in the first 90 days, the risk of a cardiovascular attack increased by 36%. In men over 65, that risk doubled. And when it doesn't cause a heart attack, it causes a stroke. I had a very healthy patient, James, 64 years old, from Chicago. He had passed all his checkups perfectly. No high blood pressure, normal cholesterol. He started using testosterone gel because he felt tired and his libido had decreased. A doctor at a private clinic had prescribed it without adequate preliminary evaluation. 3 weeks after the first application, James had a massive stroke. He is now 67 years old and is in a wheelchair. He can no longer speak. He can no longer watch his grandchildren play baseball. His wife cares for him every day. Why did this happen? Because testosterone can make your blood as thick as honey. It increases hematocrit, the percentage of red blood cells in the blood. It promotes the production of erythropoietin. The blood becomes more viscous. Viscous blood flows more slowly. Slow blood forms clots more easily. Clots in the brain arteries mean stroke. Oh, but I see the comments coming already. Doctor, I only use the gel. It's not that strong. Hold on a second. Don't fall for that. A study published in JAMA showed that testosterone gel significantly increases the volume of non-calcified soft plaques inside your coronary arteries. Those are the most dangerous plaques, the ones that look soft but can rupture at any moment and cause a massive, sudden heart attack. These plaques are invisible to normal ultrasound examinations. They only show up on CT angiography. And most people taking testosterone gel have never had a coronary CT angiography. And what about the hormone pellet? I feel so good, so energetic. My libido is through the roof. Let me give you my clear and firm opinion right here. I am against the use of exogenous testosterone that your body doesn't produce on its own, except in extremely selected cases with proven deficiency, careful preliminary cardiological evaluation, and constant monitoring of blood count, hematocrit, and cardiac markers. Period. There's a gray area. A 2023 study showed that in highly selected and monitored patients, testosterone can be safe. Repeat. Highly selected and monitored. The danger is the fancy private clinic with a doctor who wants to make quick money, who prescribes to patients without baseline testing, who doesn't monitor hematocrit, who doesn't do cardiac testing before prescribing. This year, I literally saw a case like this. A patient with known coronary artery disease, meaning documented narrowing of the heart vessels, received a testosterone prescription at a private clinic because he complained of fatigue. Without cardiology consultation, without hematocrit monitoring. 3 months later, heart attack with emergency bypass surgery. This is not an isolated case. It is a growing epidemic. Recap: decongestants with pseudoephedrine, NSAID, anti-inflammatories, omeprazole and proton pump inhibitors, ADHD stimulants, corticosteroids, and improperly prescribed testosterone. My request to you, do not stop anything on your own. Take this information, bring it to your trusted doctor and ask, Doctor, do I really need this? And is there something safer for my heart? That single question saves lives. Do you want to know what protects it? The American Heart Association listed the 6 medications that best protect your heart. If you want me to make a video on that, write protectors down below in the comments. If I get a lot of comments, I will record it, okay? Remember to like and share the video. My name is Dr. James Carter. I'm a family medicine physician and this is your health channel for people over 60. Remember to subscribe and I'll see you in the next video. Thank you so much.